High-risk behaviors of this generation pose alarming public health concerns. Teenage pregnancy is contributory alongside increasing HIV infection among adolescents. These are only few of the reasons why comprehensive sex education programs must be intensified. I'm John Laymer Delano. With me is David and Jasper, discussing on how safe sex practices are important elements of comprehensive sex education programs. Throughout this discussion, we will be we will be tackling about the goals and rules of comprehensive sex education, including inherent perspectives, more so the need for these programs to be implemented. We are also to learn about the ropes of the topic on safe sex practices and what are the policy barriers that hinders full implementation and inclusion in academic curricula. Lastly, its recommendations. I am to give the virtual floor to David for the introduction.
Greetings, everyone. Now I'm going to talk about what is comprehensive sex education, its roles, goals, and perceptions. First of all, the role of the program addresses the sex-related problems and promoting positive sexual health focused, especially among the school-age population and adolescents. It identifies important features and outcomes of sex education, which results in excellent school programs implementation across the whole nation. Its main goal includes preventing unwanted teenage pregnancies and to have a positive and fulfilling sexuality. Aside from the physiological knowledge and contraceptions, it is also important to discuss all the values, the self-esteem, and the satisfaction on self sex-related activities. However, all these activities should be done in a supportive atmosphere addressing various topics, including non-marital activities. The main aim is actually to foster changes in attitudes and behaviors besides acquiring new knowledge, according to Dickerby in a study done in 1980. Next would be the perspectives. There are two main approaches towards sex education, as we know of. Firstly, is the comprehensive sex education, or CSE, and the second one is the abstinence only education, we I call it AE. So the CSE includes information on STDs and contraceptives. As for AE, it promotes abstinence as the only safe sex method. Here are some effects, pros and cons from the studies. So the CSE demonstrated positive changes of sexual behavior by being more knowledgeable of STDs, delayed sexual initiation, increased condom and contraceptive uses. Uh, Abstinence only education did not necessarily delay initiation of sex and did not have significant positive effects on any sexual behavior, according to a research done in 2010. Next, my colleague will talk about the needs.
Education and health advocates continue to push for the full integration of the comprehensive sex education, citing its importance in addressing issues such as teenage pregnancies and sexually transmitted infections, specifically HIV among adolescents. While teenage pregnancy significantly declined from 8.6% in 2017 to 5.4% in 2022, there is still evident disparities when it comes to the data reported by National Demographics and Health Survey on the social determinants of health, giving emphasis that most cases are concentrated in rural areas among poor families in poor communities who are of lesser educational attainment as presented in the tables on the side. Also, HIV cases among adolescents have doubled in 2015 because of their high-risk behaviors, non-adherence to safe-sex practices, including reluctance in usage of condom owing to stigmatization and access. These are only few of the reasons why CSE programs are needed as they are essential.
Greetings, everyone. Now I'll be talking about safe sex practices, the must know hows and whys. Here we focuses on the use of condoms, albeit it be male or female condoms. The use of condoms is a critical component of CSE programs. Condoms have been around for a long time and are very effective in reducing transmission of sexual transmitted diseases or STDs, including HIV. Aside from it, it also has a very good proven efficacies against various types of viruses and microbes as shown in the table on the right. Amongst them, the HIV, Hep B, HPV, herpes, CMV, chlamydia, trichomonas, and so on. A study in the Dominican Republic in 2008 also found that females who receive sex education increases the HIV and the AIDS knowledge and were more likely to use condoms than those who did not. An integrated HIV behavioral and serology surveillance in 2015 in Philippines also found various levels of condom usage in different age groups among females and males, hetero and homosexuals. Overall findings showed age groups of older than 20-year-olds have a higher percentage of condom usage, likely contributing to better awareness. Next, we will be discussing about the common myths, misconceptions, fears, and negative attitudes surrounding condoms, preventing their correct and consistent usage. It can range from beliefs about their effectiveness to concerns about their impact on sexual pleasure. Common beliefs of condoms and reasons for not using it includes generally unreliable, may easily may break. Well, that's not true because it is very sturdy and elastic. It decreases the pleasure, especially for men. Well, this can be subjective, and various designs are available nowadays. It is only used for preventing pregnancies and can cause infections, backaches, headaches, even impotence, as some has believed. Well, these are all not true. HIV can pass through condoms, not effective in STI preventions. Well, this is also not true as it is proven from many studies. It is not easily and or readily available. Well, not in the situation nowadays. Social stigmas. I'm shy to buy it and commonly relating it to infidelity or having multiple partners. Well, L, L, this is a social stigma. And then my partner doesn't like it. Well, this is a inadequate understanding. Well, some medical problems, especially in males, also contributed to it, such as alcoholism, depression, and anxiety. Well, it is also claimed that it is not available when needed immediately, and also there are those who are having stereotype behaviors who knows about condoms but just prefer not to use it anyway. Even some will argue that two condoms are better than one, which is not the case. And then during oral sex, there's no need for condoms. Well, that's not true because it's unprotected. The graphs on the left basically shows us the percentage of the adolescents groups reached by the social hygienic clinic, the SHCs, and the services provided. Among them are males and transgender males, female sex workers, FSWs, and the persons who inject drugs, PWIDs, and also the usage of condoms among them. It depicts the number of growing HIV epidemic among adolescents in the Philippines from a surveillance study done in 2015.
So, good evening, everyone, and I'm continuing off from our discussion on condoms. So, with regards to the policy barriers, so in terms of legislation, we have a Republic Act, an act providing for national policy on responsible parenthood and reproductive health, highlighting, of course, the importance of your education in RH and family planning. However, when we look at it more closely, CSC was deemed as unconstitutional as it is with no legal basis since CSC is not anchored on the reproductive health law. Basically, which we will discuss later on, uh, the Republic Act itself does not automatically justify the discussion of CSV in different institutions. However, when you look at the agencies implementing the Republic Act, we have DOH in partnership with our LGUs who are already providing oral contraceptive pills and birth control methods such as your condoms to the general population. So, as well as the corresponding lectures relative to the law provided. Okay. In contrast, the Department of Education still adheres to its own traditions in terms of teaching family planning, particularly for condoms, and is still very much against its implementation. Actually, if you would recall, in one of the most recent news here in the Philippines, certain political figures have presented their disdain on the implementation of CSE by DepEd as they created their own curriculum, even to the point as mentioning that it will be teaching masturbation to your children. Okay. So with the policy barriers, what are the things that we can do? As I mentioned before, in terms of your CSE, you must have a separate legislation which really mandates its inclusion in the current curriculum, not just the provisions in regards to the reproductive health bill. Okay. There are also policy mandates in the local government units and possible utilization of your gender developments to current public health concerns on teenage pregnancy and increasing cases of adolescent or teenage testing for positive for HIV/AIDS, which is also basically us mentioning that there are some issues within terms of implementation of this curriculum of the reproductive health, and as such, we should have more heavy-handed implementation through your various agencies in really focusing on the issue itself regarding your comprehensive sex education as well as the use of your condoms. In terms of health promotion and behavior change, of course, we want our adolescents to develop a health-seeking behavior, and there should be proper information dissemination and other contraceptives and testing and surveillances. And then I came across one of these articles on with the population of on Commission of Development, wherein there is an importance in utilizing different platforms such as your social media, TV, radio, etc., in changing actually the perception and stigma in the use of contraceptives. Apparently, they also mentioned that it will really take time for us to really develop out of our own habits or traditions, especially in the Philippines. Okay, so there are high-risk behavior among YKAP coupled with low knowledge and limited access to HIV services. It's the primary reason for escalating HIV pandemic among adolescents in the Filipinos. So one of the strategies is to really increase the access of HIV services should as a priority. So the increased knowledge of your young key affected populations on HIV access to an HIV prevention package through our participatory targeted multi-platform approach activities that are cognizant to your face-to-face interventions. And improve HIV testing uptake by YKAP by promoting the availability of course, their HIV testing and establish safe treatment community-based to increase linkages to care among HIV positive adolescents. Okay, so here are references for this, and that's it. Thank you.